Hello. Are you an MRI technologist trying to learn cardiac MRI, or maybe you just need a refresher? Well, cardiac MRI can be pretty challenging, and there's many different strategies that we can use to approach this big topic and learn more about cardiac imaging and how to do it. Anytime that we try to learn cardiac imaging, the first thing you need to do is start by memorizing your anatomy and physiology. By understanding the structures of the heart, it will help you in so many ways in understanding things like plotting or exam and pathology as well. After mastering your anatomy and physiology of the heart, it's important to understand the different views that we can have in cardiac imaging, and there's so many of them, and they require us, again, to know our anatomy. So then after mastering how to plan your exam, how to scan and plot those 2-chamber, 4-chamber hearts, the LVOTs, the RVOTs, then it's important to move on to the next step and understand the technical factors. And everything in cardiac imaging is focused on temporal resolution, which means that our parameters start to look a little different, especially because we're going to be doing things like cardiac gating and respiratory gating as well. And so in terms of the cardiac gating perspective of it all, we're going to be using something either prospective gating or retrospective gating, like Cine techniques. And again, we can look at it from a dark blood imaging, which is more of a single shot fast spin echo sequence, to a gradient based sequence for our bright blood sequences, maybe a steady state free precession. And then after we understand the technical factors and how to manipulate our parameters to optimize that temporal resolution, to really focus in on optimal cardiac imaging from our TR standpoint, from our inverse recovery sequence standpoint, it's important to understand pathological issues as well. I mean, people have arrhythmias. How does that change my technical planning and parameter selection? And then finally, there's other techniques like stress tests that we could do under MRI, cardiac MRI, that allow us to really get a better look at how the heart is actually functioning, perfusing contrast media as we inject, and looking at the delayed images and why they're so important in cardiac imaging. So there's so much to look at from a cardiac MRI perspective. And so if you are looking for proper training to go through the anatomy, plotting, technical factors, pathology, and so on, RITE Advantage, RITE Advantage, is a tool for you, because it starts you out with the anatomy and takes you through the entire process. So whether you're a beginner or someone who needs a refresher, our cardiac MR course is perfect for you. So if you're interested, click on the link below and you'll be redirected to our cardiac training modules and courses that'll help you master cardiac MRI. Thank you for joining and listening.